Your blood pressure can rise in seconds, without warning. What if the fastest way to calm it down isn't a pill, but something you're doing wrong every minute of the day? There is a natural switch in your body that directly controls stress, blood vessels, and heart rate. Most people never learn how to use it. In this video, you'll see how small changes can create surprisingly fast effects. Stay until the end, because the last technique is the one people use in real emergencies. High blood pressure is often treated as a purely mechanical problem. When the numbers rise, the usual response is to increase medication doses or add new ones. While medication can be essential and life-saving, this approach often overlooks one of the most powerful regulators of blood pressure that exists inside the body itself, the way we breathe. Breathing is not just about oxygen intake. It is a direct communication line with the nervous system, influencing blood vessel tension, heart rate, and the release of stress hormones throughout the body. Most people breathe without ever paying attention to how they do it. Fast, shallow breathing is common, especially during stress, worry, or mental overload. This type of breathing quietly activates the body's stress response. Blood vessels constrict, heart rate increases, and blood pressure rises. The body interprets this breathing pattern as a signal that danger may be present. Slow, controlled breathing sends the opposite message. It activates the parasympathetic nervous system, often described as the body's rest and recovery mode. When this system becomes dominant, blood vessels relax, heart rate slows, and blood pressure can begin to decrease, sometimes within minutes. This response is not a placebo effect or a mental trick. Research has repeatedly demonstrated that specific breathing patterns can lead to measurable reductions in systolic blood pressure in a relatively short period of time. In certain studies, the average reduction is comparable to what is seen when an additional blood pressure medication is introduced. The crucial difference is that breathing techniques require no prescription, involve no chemicals, and can be practiced anywhere without equipment. One commonly used approach focuses on extending the exhale. The underlying principle is simple but powerful. A longer exhale signals safety to the nervous system. Structured breathing rhythms that emphasize slow, complete exhalation naturally shift the body away from stress and toward relaxation. After only a few minutes, many people notice a slower heartbeat, reduced muscle tension, and a sense of calm that is often reflected in lower blood pressure readings. Practiced consistently throughout the day, this technique helps train the nervous system to respond more calmly, even during stressful situations. Another widely used method is known as resonant breathing. This technique involves breathing in and out at a steady, balanced pace, typically around 6 breaths per minute. At this rhythm, breathing, heart rate variability, and blood pressure regulation begin to synchronize. The cardiovascular system works more efficiently, stress hormone levels decrease, and blood pressure becomes more stable. Because this method does not require breath holding or forceful breathing, it fits easily into daily life, whether sitting quietly, waiting, or relaxing at home. A third technique is often reserved for moments when blood pressure rises suddenly due to anxiety, panic, or emotional stress. This method uses alternating breathing through each nostril in a controlled pattern. By slowing breathing automatically and balancing nervous system activity, it can help calm the body more quickly during acute stress. Research suggests that this approach may reduce blood pressure faster than standard slow breathing, making it particularly useful in high-stress moments. The true strength of these techniques lies not only in their immediate effects, but in regular practice. Just like any habit that influences health, breathing exercises are most effective when done consistently. Over time, the nervous system adapts. Stress reactions become less intense, baseline blood pressure may improve, and sudden spikes become easier to manage. These techniques are not meant to replace medical care. Anyone with high blood pressure should continue to follow professional medical advice and should never stop prescribed medication without guidance. However, breathing practices can complement medical treatment and may support long-term improvements when used alongside proper care. Safety remains essential. Breathing should feel natural and comfortable, never forced. If dizziness or discomfort occurs, slowing down is advised. Individuals with severe lung conditions should consult a healthcare professional before beginning structured breathing exercises. For most people, however, these techniques are gentle, accessible, and safe. The most important takeaway is this: The nervous system plays a central role in blood pressure regulation, and breathing is one of the fastest ways to influence it. With just a few minutes of mindful breathing each day, many people experience calmer heart rhythms, reduced stress, and more stable blood pressure readings. This is not about perfection or instant fixes. It is about awareness, consistency, and learning to use a tool your body already has. If this video provided practical insight you can apply right away, consider following the channel, liking the video, and sharing your thoughts in the comments.